Hi, Dr. John Torres here on my Doc to Doc series, where a couple times a week I go over headlines, mostly coronavirus, pandemic related headlines, but get other headlines in there as well in health related topics that I think will be of interest to you. And what I do is I talk about the headlines, but also give you information below those headlines, what it means particularly, and more importantly, what it means for you, your family, your loved ones, and your community, and hopefully help you live as healthy as possible and get through this pandemic as soon as possible. And then I answer questions you might have. So if you have questions, please send them our way. We try to get to as many of those as possible. Let me start off first with the headlines. Number one, the first headline are probably the vaccines out there. And when are children 5 to 11 years old, and as a matter of fact, under the age of 12, going to be getting their vaccines? And that timeline has shifted back and forth a little bit, but here's what we do know. We know that right now they are looking at human trials on children under the age of 12, and they're doing it in 3 different groups: 5 to 11-year-olds, 2 to 4-year-olds, and then 6 months up to 2-year-olds. And the reason they're doing that is because each one of those age groups needs to be looked at specifically to make sure that the dosing, the intervals between the dosing, all those are done correctly. One of the things, and I talk about this frequently, one of the things that we were taught from the moment I went into medicine and started doing my emergency medicine residency is that children are not just small adults. And what they mean by that is you can't take a 50-pound child and say, well, they're going to take half of the 100-pound adult dose, or a quarter of the 200-pound adult dose. Since they weigh that much, let's just cut the dose down and give it to them. That's not the way it works, because children, their immune systems work a little bit different, their physiology works a little bit different. So in essence, again, they're not just small adults, they need to be treated specifically, and we need to understand how these vaccines are working on them. Well, right now, what they're doing is they're running human trials. They're in the third stage trials on children in those 3 different age groups, and they're doing them all simultaneously. The reason they're doing that is, well, obviously we're in the middle of a pandemic, this emergency, and we want to protect those children as best we can, because I've even said frequently the best way to protect children under the age of 12 now are to make sure that those above the age of 12, particularly adults, their parents, are vaccinated around them, because that will create a protection bubble around them that hopefully will keep them protected. Once the vaccine becomes available, then that's going to be one of the better ways to protect them as well, to make sure they get vaccinated. Well, the reason this is news is because up until now, we've been talking about them getting the vaccine sometime around Thanksgiving time frame, maybe a little bit before, maybe a little bit afterwards. And then that's for the 5 to 11-year-olds. For the 2 to 4-year-olds, probably early in the year of 2022. And then for the 6-month to 2-year-olds, probably more springtime of 2022. Well, Pfizer just announced that they actually are going to submit their paperwork at the end of this month for 5 to 11-year-olds in the third stage trials. And they're going to accumulate all the data, submit it to the FDA, and then they're hoping the FDA can review that in October. They have mentioned this timeline before, but that timeline has kind of slipped a little bit every now and then. And so as of now, what it looks like is at the earliest, again, it might be mid-October, a little before Halloween, but it might push back until November. They're also saying that they're looking at doing even younger children a month after that or 2. And so these could come very sequentially, very quickly. And so it is possible that by the end of the year, we have the vaccine for children 5 and up, and then we possibly might have the vaccine for children 2 and up, as well as the ones that are getting it right now. And so that would be great news if we do get to that point, but at the same time, it's one of those issues that has been out there for a while. The date has slipped a little bit, and even the Pfizer CEO has said, this obviously depends on how the trials go and what the data looks like, and whether they need to go back and get more data and more information. And it's possible that they submit the data to the FDA, and the FDA says, that's nice, but go ahead and go back. We want a couple of specific things that are going to take you a few weeks or a month or 2 to get as well. And so again, probably at the earliest, mid-October, a little before Halloween, more than likely before Thanksgiving timeframe, we'll be getting these vaccines for children 5 to 11 years old, and then they'll be getting it along with the 12 years old and above. More than likely, it'll be a different dosing than what adults and 12-year-olds and above are getting, but we'll see when the human trials come out and what the data actually looks like. Now, as far as adults, the big news there are the booster shots. What's going on with the booster shots? And that has been going back and forth a little bit too, with a bit of contention right now. So the White House last month came out and they said, President Biden said that he wants people to get booster shots 8 months after receiving their last vaccine, starting September 20th, which is right around the corner. Well, the FDA came in and the FDA said, we're not sure we can do September 20th at this point because we're still looking at all the data. And then Lancet, which is a medical journal, came out with a study, basically a review that a lot of authors, a lot of researchers signed on to, including two researchers, Dr. Gruber and Dr. Krause. Now, the reason that's important is because they are part of the FDA's vaccine organization, vaccine office that looks at these vaccines and decides when we're going to get vaccines, when we're going to get boosters. And both Dr. Gruber and Dr. Krause have come out saying they don't think we need boosters at this point. It's not something that needs to be done imminently. As a matter of fact, their feeling is that the shots we have now without the boosters, just the regular vaccines we have, are giving us good protection, and we need to remember that and then use these vaccines for other people around the world and to try and get the rest of the world up to this 70% level or so we can get this under control. Now, again, the White House is saying they want booster shots here September 20th. The FDA will review it, but two people in the FDA who did this independently, aside from the FDA, they're saying, we're not sure we need that. So what will happen is this week, at the end of the week, the FDA is meeting to make a decision on boosters in particular. And so we'll know more what happens Friday when the FDA meets. And if the experts at the FDA will decide, yes, go ahead and move, they could do a couple of things. And I put it into three different categories. One is, let's go ahead and do what the White House has asked for. Let's do boosters at the 8-month point after your last vaccine, starting September 20th, which would be the following Monday. Number two, they could say, we're not going to do any boosters yet. Let's just do what we have, get people fully vaccinated. We're getting good protection, and let's go ahead and keep moving forward and find out when we do need boosters, which could be eventually down the line. Or three, middle of the road, and this might be the way they go, they say certain groups might need boosters, as in those 60 and above, those 65 or 70 and above. Those people might need boosters, or people that have underlying health conditions that could make them more likely to suffer complications from COVID. If you remember when the vaccines first came out, those were the ones that were in the first phase of COVID vaccinations. And they might be the same ones that they say, let's go ahead and get them the boosters. Everybody else will hold off on for now. And what this basically comes down to, and it can get very confusing, is it comes down to two different ways of looking at what the vaccine should do. Now, what the White House is looking at is saying, okay, we want the vaccine to cover COVID, make sure everybody's protected, but also cover those mild cases of COVID, maybe moderate cases of COVID that could potentially spread to other people. What the FDA, especially what this Lancet letter came out with saying, is that the booster shot should protect us from serious illness, hospitalizations, and death, which is what it does a great job of doing from these vaccines. And so we don't need boosters because the vaccines are already doing that. And at this point, we don't need boosters to protect us from that mild to moderate disease that could be out there because of the Delta variant. And so it's two different organizations looking at it two different ways. The thing you have to remember, even though the White House has recommended that we get boosters starting September 20th for those 8 months after getting their last vaccine, FDA are the ones that have to either approve or authorize that, and then the CDC has to recommend it once they get that approval or authorization. So the White House, even though they are requesting that or looking into that or recommending that, they don't really have much of a say there. The FDA and the CDC are the ones that decide that here in the United States. And so we'll find out Friday what happens. And so I'll have more news come at the end of the week. We probably won't know until late Friday when they make a decision. So probably won't know more until next week, but it'll be interesting to see what happens there. Now, the third thing I want to talk about is a non-COVID one. And like I've mentioned, I've tried to get non-COVID related health information that can help you out in this segment. And the one I want to talk about is a study that actually came out of Cambridge. It just came off embargo, and so we can talk about it now. But the study, they looked at 19 workplace cafeterias, just your regular cafeterias. And that's always been a bit of an issue for people because they go to the cafeteria, their choices are fairly limited, and so they end up eating more than they probably normally would eat. And that can pack on the calories, which unfortunately can put on some extra pounds, which can help with the issues we have now in this country with overweight and obesity problems going on in the country. What they did is they looked at this 19 cafeterias and they changed a couple things. They just tweaked a couple of things. And they found out that by tweaking those things, they were able to really cut down on the calories people were eating without people even having to think about it. And this basically falls partially into our eyes can really trick our stomach. And so we want to make sure that we understand this. And what they did is two different things. One is they basically substituted high-calorie foods for more low-calorie foods. And here's the example I'll give you. Now, if you look here, this is bread, regular wheat-type bread, and 2 slices of bread, 110 calories. So instead what they did is they substituted them for things like this wheat tortilla, which is 70 calories. And you can see you can still make a similar sandwich with this versus this, but you save 40 calories there. And they found out that by making these simple substitutions without even telling anybody and just having people go through and do their regular lunchtime meals, that they were able to cut down 4.8% on their calorie intake over time, per day. The other thing they did, portion control, and I've been a big advocate of portion control. And I always tell people, if you want to see what's happened with portions over the last few days, just look at, if you have a grandmother and you can go, or grandfather, and you can go to their pantry, and their pantry is the same as it was back when you were a kid, look in their pantry. More than likely, you're going to find smaller plates. If you go to antique stores, you typically find smaller plates, because back then, plates were around 9 inches or so, and now they've gotten up to the 12-inch point. And so because plates are bigger, we tend to put more food on the plates, and we tend to clean off our plates. And so we tend to eat all that food. So the second thing they did, which I thought was pretty smart, is they basically took portions and they said, we're going to give you smaller portions. We're going to give you smaller plates. So instead of these large plates, they gave the smaller plates here. And on top of that, we're going to cut the portions down. One of the examples I gave with lasagna, they just cut the squares of lasagna a little smaller. And so people still got their square of lasagna, it just wasn't quite as big. Or instead of 4 meatballs, they gave them 3 meatballs. Or the meatballs were smaller. They basically cut down on the portions. Well, they found out when they cut down on the portions and also made those calorie substitutions we're talking about, so bread or tortillas instead of bread, they ended up cutting their calories by over 11% that day. Now that might not seem like much, but we're talking 50, 75 type calories a day, maybe even a little bit more, and that can really over time cut back on some of the pounds, and particularly not allow you to add those extra pounds year after year that typically happens. So again, just some simple tweaks that can really help out, and similar things you can do in your household. And I've talked about this many times, that we are going to eat what's available. So if you have high calorie foods that are available, you're going to eat high calorie foods. Another example I can give you, and I'm certainly not going to name any names here, but if you look here, sports drink, this has 140 calories. If you look here at carbonated seltzer water, this has no calories. So 140, no calories. Simple substitutions like that can certainly help go a long ways towards keeping those pounds off and even getting rid of some of those pounds. And so easy things to make, if that's what's available around the house. If you have potato chips or carrot sticks in the house, if you only have carrot sticks, well, that's what people are going to go for, much healthier than the potato chips. But again, moderation is the key, and that's one of my big things, everything in moderation. So hopefully that helps out a little bit. But now I want to find out if you guys have any questions.
Do the current vaccines help against new and future variations of COVID-19?
So the question is, how much do these vaccines help against current and future variations or variants of COVID-19? Well, as far as future variants, we don't really know, because we won't know until those variants are here. But one word of caution, the best way to cut down on variants are to have more people vaccinated so the virus can't get in your body and make these variants. But what viruses do, and they're very good at this because they want to survive, is they basically change inside the body a little bit. Some of those changes make the virus not as effective, and they're called deleterious mutations, not as effective, and so the virus doesn't work as well, and those just kind of fade away with time. Some are advantageous changes, and those advantageous changes can actually help them become more contagious. It can help them produce more viruses. It can help them possibly even be more deadly. What we know about the variants so far is they've become more contagious, but typically haven't become more deadly, which is important. But the contagious part means that more people are going to get it. And there's the possibility, too, that because of the changes, it could evade some of the protections from the vaccine or from our immune systems. And we're seeing that happen a little bit with the Delta variant. But what's happened is it can evade it again. It can evade it to the point where you get mild to moderate disease, but so far hasn't really shown the ability to evade it to the point of you getting seriously ill, hospitalized, or dying from COVID. That occasionally happens in very rare breakthrough cases, but not that often. And so the key is right now with the variants we have, the vaccines are working great at protecting us from those three, the serious illness, hospitalizations, and deaths. Not as well those mild diseases of COVID that we could possibly get, but future variants could possibly alter that. And that's why we need to be very, very careful.
What about naturally occurring antibodies? Can't we rely on that?
So naturally occurring antibodies, can we rely on that? And part of the question is it depends, which I know I say a lot, but it depends, one, on when you got your COVID infection. If you got the COVID infection early on with the wild type virus, or even later on with the alpha type virus, we don't know how well it protects you against the Delta type virus. On top of that, if you get it now with the Delta virus, we still don't know how well it's going to protect you against future variants or the Delta as time goes on. And what we do know is it can give you a few months of protection, but beyond those few months, it seems to wear off. And so that's why they're still recommending vaccinations for people who even been infected, even recently been infected. And so the main point to know is that the natural immunity you get from getting infected can last a little bit, but it doesn't seem to last all that long. Plus, it depends on how much of an infection you got. If you had mild infection, you might not have that much protection. If you had severe infection, you possibly could have more protection, but that could still wear off. When you get the vaccine, we know what dosing you get, we know how much protection that gives you, and we know so far that that protection seems to last fairly a long time, and hopefully even longer than this.
Do you know if immigrants are being vaccinated for COVID before coming into the country?
So the question is, do we know if immigrants are being vaccinated for COVID before coming in the country? Well, there recently was some news about them having to halt immigrations from Afghanistan, I used that as an example, because of measles outbreaks there. And what they had done is they had made arrangements and saying, if you want to come to the United States, you need to be protected against measles, mumps, and rubella. You need to get the MMR vaccine. But they were giving it to them once they got to the United States. And some of them came over, and there were a few that came over that had measles already, and so they had to halt some flights. Now, as far as COVID vaccines, I know what's going on across the border when they come over across the border is they are saying, the vaccine is available. Do you want the vaccine? But they're not mandating the vaccine for them, just like they're not mandating the vaccine for people here in the country. Some people are getting it, some people are not getting it. And so the concern is, could they be bringing COVID over with them? They do test them, and so it doesn't appear that they are bringing COVID. We haven't seen huge outbreaks other than in the migration centers that they might be at before they end up moving throughout the country. There have been outbreaks there, but as far as them spreading it throughout the country, doesn't seem to be an issue. And as far as how many are getting it, it seems like there's decent uptake, but not 100% uptake of the vaccine at this point. So. Okay, that's all the questions we have. So again, thank you very much. The 3 topics I want to go over. Number 1, again, what we talked about, vaccines. Pfizer has said they're going to submit the data for 5 to 11-year-olds. Hopefully they get it to the FDA by the end of the month, and the FDA can review it mid-October. We'll see if that really happens. We've heard this in the past, and that timeline has slipped a little bit. So my guess is before Thanksgiving, we'll have it, possibly before Halloween for 5 to 11-year-olds. And then they're saying a month after that for 2 to 4-year-olds, and possibly even soon after that for 6-month-old to 2-year-olds. They're doing all those studies right now. And I know, Moderna is right behind them doing their studies as well. Talked about booster shots and the sort of a bit of contention between the White House, who wants them by September 20th, which is just a few days away, and the FDA, who will review them this Friday. 2 members of that review committee, essentially, are Dr. Gruber and Dr. Krauss, came out in Lancet with a paper saying that we don't need these boosters at this point yet, because we're still getting good protection from the vaccines. And so we'll see what the FDA decides on this Friday at their meeting. And then we talked about the study that was done out of Cambridge, where they looked at 19 cafeterias. They cut down on portion sizes. They made substitutions, high calorie for low calorie. So instead of bread, it was tortillas, that type of thing. And they ended up with that combination cutting people's normal calorie intake per day by over 11%, which is fantastic. So food for thought for your own house as well. So if that's something that you think that can help you guys out, certainly something to do, and something that can hopefully help the whole family out. But like always, I hope you have a fantastic week. And I hope, as I always say, that you, your family, your loved ones, and your community stay as healthy and as happy as possible. So thanks a lot.